immemorial, and ever since modern day medicine has been around, similarly, osteomyelitis has been around. So the term is coined by Nelaton in 1834. And how does it present? Well, it could be a solitary focus of disease. What does that mean? That means that it can involve just a little focus or just a little part of the bone, or it could be systemic. That means that involves many bones at the same time. Now, the inflammation of the bone can be localized or it could spread through the bone and go to the marrow, cortex, periosteum, the surrounding soft tissue, and subsequently other areas of the body. So if we look at the type that is based on duration, yes, osteomyelitis is an infection, but like all other infections, we can classify this on the basis of the duration of the symptoms. So if it's in the acute phase, the patient would say that he's been having fever or pain and tenderness for a duration of less than 2 weeks. If it's subacute, then the duration will be something between 2 and 6 weeks. And if it's chronic, then of course the duration would be longer, and that is more than 6 weeks. Now, another thing is that osteomyelitis is technically, rather orthopedicians, they prefer to classify it as primary or hematogenous, that is when it is spread through the bloodstream, and secondary, that having an open fracture or surgery. So the two modalities by which we generally see osteomyelitis is because of, and the secondary one actually could be, for example, an implant or some other procedure was done, some major surgery was done, and because of the implant being inserted into the body, secondary bacterial infection leading to secondary osteomyelitis. So the relevant anatomy, we all know that the bone has the epiphysis, the metaphysis, and the shaft portion is the diaphysis. Now, if you look at the vascular arrangement within the bone, so you can see that the vessels have a very hairpin arrangement or the hairpin loop. Now, the arrangement of the vasculature in such a fashion actually favors vascular stasis. And so it's a very fertile ground for bacterial infection. Note that the metaphysis is a highly vascular zone, right? So most of the infections are actually going to be starting off from this hairpin loop area. Osteomyelitis can be caused by various organisms. The organisms may be viruses, parasites, fungi, and bacteria. Now, if we look at bacteria, then mycobacteria are common in India, and tubercular infection is actually one of the most common forms of osteomyelitis. Now, it's just a myth that osteomyelitis, especially tubercular, would be just confined to, the lower socioeconomic strata. We have had many of our NDBS batchmates who have been afflicted with extra pulmonary tuberculosis, and this actually takes more than a year to cure, so it's not a very nice disease. Then you have pyogenic osteomyelitis. So this is almost always due to bacterial infection. See, the word pyogenic means when there is creation of pus, right? So creation of pus is pyogenic, and the organisms reach the bone by hematogenous spread. So if anyone already has organisms or bacteria in the bloodstream spreading through the blood, it is the hematogenous spread. Contiguous spread means spread in the neighborhood. That means if the soft tissue is infected, then if that does not resolve properly, it goes down to the bone. And the third thing is direct implantation. So you have, for example, you've inserted an orthopedic plate with screws and nails inside the body, and it wasn't sterile, it wasn't, cleaned properly. So that's a direct nidus of bacterial infection. So what is the net result? The net result is that you have microorganisms that are reaching a deep structure, and that is the bone. Now, just a sec. Can you see this slide at least? I don't know why this is. Can you see the slide?
Yes, ma'am.
Yeah, but it's not moving. Not going into ESC mode either. Let's see what we can do about it. Okay, right. So now you have bacteremia. Now bacteremia is basically caused by various things that can happen to the body. So one is trivial mucosal injuries. That is when the mucosa is ruptured because of any cause, right? The second is defecation. Now defecation, you might wonder, how is this going to cause bacteremia? Well, in cases of chronic constipation, because of the friction involved at the rectal mucosa, you actually have mucosal injury. And the perineal and rectal area being very, very vascular, mucosal injury because of that can result in spread of microorganisms. You have vigorous chewing. Again, the oral mucosa is very delicate. Any injury or any insult to the mucosa, it can cause bacteria floating in through the oral cavity throughout the entire body. You have skin infections which are deep and non-resolving. You have road traffic accidents which are going to cause deep, boring, penetrating a number of things can happen to the human body which can cause infection. Now generally we're used to seeing infections like boils or small infections, but sometimes when the host is immunocompromised, those small superficial infections actually can penetrate and reach a deep structure like the bone, and then it causes a problem. So there's a whole list of organisms that can cause osteomyelitis. Staph aureus is the most common. We all know that it's a gram-positive bacteria and it's the most common bacteria. The other common ones are strepto and pneumococcus. And these two, E. coli and Pseudomonas, they're generally seen in hospital settings, hospital-acquired infections. Salmonella is seen in association with sickle cell disease and Klebsiella, and no specific organism, mind you, is seen and isolates in 50% patients. And another situation may happen that you get a bacterial infection, but it's a combination of all the above. Now, if you look at the diagnosis, basically, you know that clinical is based on various features, and those features will be described later. Examination, the patient would be febrile, would be dehydrated, and then on local examination, there would be tenderness, there would be redness of the area, and there may be decreased mobility. Now, investigations, the blood is going to show neutrophilic leukocytosis, more so if we are examining the patient in the acute phase. The second is an elevated ESR. The third is X-rays. If you perform an X-ray of such a patient, then you would see in the first 7-10 days there would actually be new bone deposition at the periosteum, and bone scan would show increased uptake, and that is even before the other features are seen on X-ray. Now, what are the predisposing factors? As I've already mentioned to you, if you look on the right, everything that weakens your host can predispose to osteomyelitis. So if the host is malnourished, immunocompromised due to diabetes, due to malignancy, due to having chemotherapy, due to extremes of age, they can be predisposed to that systemic bacteremia I was talking about. And then there are local factors like lymphedema, venous stasis, arthritis. Now I'll just explain all of this. So what is lymphedema? Lymphedema is nothing but stasis of the lymphatics, right? So the lymphatics, the lymph is not flowing freely in the body. And because of that, you would see swelling of the lower limbs. Now, the second thing is in the elderly, you have something called venous stasis. What does this mean? If you have grandparents at home, you would know that sometimes they have difficulty in walking. Sometimes you can see that in the lower limbs, their veins are become very prominent and tortuous, and that is because the vessel walls become weaker and thinner as we age. And because of the weakness of the walls, the circulation is impaired. It tends to just gravitate and it does not move properly, the venous circulation. So there's stasis. And that's why you can see ulceration more frequently in the elderly. Then you have arthritis, which is an immune mediated infection of the blood vessels. You have scarring because of any reason. So if you have a skin scar, or you've had an operation or a major surgery, and there's a scar, for example, there's a scar on your knee because of some major fall down you've had. Now that scar would remain, but sometimes the scar itself can be a nidus for a bacterial insult, subsequently leading to infection of the bone. Radiation fibrosis, because of radiation, the skin becomes weak, fibrosis happens, altering the structure above the bone, which, if